light is on. So today we're going to describe the lower cross syndrome, which is a combination of weak muscles or stretched muscles in combination with tight muscles. And the typical lower cross syndrome we see is the abdominal muscles might be weak or stretched. The hip flexors would be too tight or strong. Flipped over on the back side, the glute muscles would be weak. So we have tight in the front, weak in the front here, and then tight in the low back. And usually as compensation, the hamstrings will become too tight as well. And that can set off a walking pattern that essentially causes the glute max not to fire properly. The hamstrings do all the work, and people start actually hinging from their back when they're walking. So that instead of getting a kick off with your glute, so Betsy, go ahead and kick this leg back a little bit. You can see how her glute max is firing. That's good and normal. If your glute max doesn't fire properly, your hamstrings and your low back do it, and you end up hinging at the hip like this, hinging in the low back, creating a lot of low back pain unnecessarily. So let's start with stretching for these muscles here. I'm going to have Betsy get up onto the table in tabletop position, so all fours. And this is classic, simple, you got it? Okay. This is classic, simple yoga type thing. So we're going to have her do some flexion or cat. There we go. And she's going to get some stretching through here. If she doesn't feel the stretch here as much as she'd like, she can drop her hips back a little bit, reach with her arms, and open up the lumbars. And it's important that there be no pain with that. However, if it does feel like a good stretch, I usually recommend that people spend 2 or 3 minutes in that position to allow for some very slow, deep muscle elongation. All right? Then come back up into tabletop. The opposite is the cow. And in cow, we're actually getting a stretch through the front. This isn't necessarily a muscle stretch as much as it is just relaxing the spine, allowing the spine to loosen deeply in here. Okay? Now let's go on to stretching the psoas muscle. So I'm going to have you go ahead and kneel on one knee for me. Actually, let's do this now. This is great. This is a glute medius stretch and a piriformis stretch, known as pigeon pose, and that you want to really drop that hip down, and you can even walk your arms forward if you want. So you can see she's very flexible. She's getting a great stretch on some of her deep hip rotators. Will you trade sides so we can see it on the other side just for the camera? There you go. And at first, with this stretch, you probably won't be able to go as deeply as Betsy is. You want to put your foot where it's comfortable, drop down, keep your back flat. You'll feel a deep stretch in that hip back there. Okay? Once again, you want to hold these for a couple minutes. Take your time. It shouldn't hurt, shouldn't burn. Okay? Now go ahead and just kneel up. Come all the way up. There we go. And let's have you put this foot forward. So now she's going to work on a stretch for these tight hip flexors right through here. This is the psoas stretch. And this stretch is important. I'm going to cross over. It's important to do this in a couple phases. So let's start back at the beginning. She's kind of advanced here. The first thing we want to do is we're trying to activate this glute max while we turn off the hip flexor. So the glute max, she wants to drop her hips under a little and fire off that glute max. So I tell my patients, reach back, touch your glute, and make it tighten up. A little squeeze of the tush. While you're holding that, drop your tailbone under a little, and then come forward. Don't arch your back too much. There you go. And once you begin to feel a pull through there, that's your stretch. So you're going to hold that stretch. You want to make sure you keep your stomach drawn in so you're not getting too much of a bend in your spine. You're going to pull the pubic bone up towards the sternum and hold the stretch. And if you want to bring in the last part of the stretch, then you reach up with this arm and slightly side bend off to the side so that you're getting a pull all the way through. And you can accentuate it by bringing your hips forward a little more, reaching back and sideways. There you go. and you will feel a really good deep pull through the front of that hip. Okay? Excellent. Good job, Betsy. Now let's go ahead and let's cut for a second. Let me think about